Now, I've entitled this Setting the Record Straight on America's Healthcare, but there's another part of it, which, of course, is where do we go from here? I'd like to start always with this slide, which is a quote from former Senator Moynihan. Everyone is entitled to his own opinion, but not his own facts. And there is no other area in policy that is so strongly influenced by opinion that is not based on fact. So I'm going to try to set the record straight by going through a lot of facts. And just as an introduction to the whole concept, in case no one knows the perspective on this, the overwhelming majority of people in the United States have private health insurance, which is generally provided through employment. And we can see on the numbers here that we're talking about 200 million people, plus or minus, that have private health insurance. Just remember that when somebody in a presidential debate says they want to eliminate private health insurance, that might be a little disruptive to what people have opted to spend their money on. And despite all of these sort of changes, there are still millions of people that are uninsured. Now, there is one very basic fact that is undeniable, and that is that the United States spends more on health care than any other country in the world, and that is by virtue of calculations on percent GDP or per capita. And this is this is a chart from pre-Obamacare, 2008, compared to the other OECD countries. This is basically the other countries in the developed world, give or take. This is the most recent data. Again, we are the leader in the money we spend on health care. There's another sort of interesting paradox. About 80% of Americans are highly satisfied with the quality of their own health care, and this has been the state of things for decades, really. Yet, even though they are personally satisfied with their health care, the same percentage of people somehow say the system needs fundamental change or complete rebuilding, which to me is sort of a paradox and difficult to explain, although there are many possibilities, including the fact that they are just completely misinformed by the sort of mythology surrounding U.S. healthcare. Much of the assertion about U.S. healthcare stems from this study, which was a study by WHO in 2000, the World Health Report, that generated data, quote unquote, from about 191 countries. And there was a ranking, and this is the overall performance of healthcare systems, and you can see the United States is ranked 37th in the world. And you don't have to be a doctor, you don't have to be a patient, you have had no experience with the healthcare system to say, wait a second, I mean, there's something funny about that. We're in the company of places like Costa Rica, Slovenia, Cuba on healthcare quality. There's something fishy there, you might say, without even looking at the data. So people did look at the data and the way that study was done. And here's how the study was done. The first point is that about 2/3 of the rank was based on equality, not quality. If everybody got a C, that was a better system than if some people got an A and some people got a C. That's 2/3 of the rank right there. There are other problems, including very highly subjective inputs, arguable assumptions about relative importance. The data was missing from dozens of countries, missing, yet filled in on the basis of the feeling of the people doing the study. There were huge measurement errors with no statistical significant difference between them, and many of the important inputs do not even reflect healthcare quality. Now, are these just my opinions? Well, no. If you look at the health policy literature, the peer-reviewed literature, all of those facts and more criticisms were written. The study was thoroughly vilified in the literature of experts, yet the findings are constantly repeated by our politicians. This is just an example of the lack of statistical significance, by the way. If you look at this, here's a bunch of the countries that were ranked, and you really don't have to be a statistician to understand that if these are the error bars, there's no significant difference between these, yet these were ranked numerically in these charts. What about some of the data that people seem to say whenever I give this presentation? And that as well, but the system is no good. Why is our life expectancy is nowhere near the top in the world? Isn't that an indictment of our healthcare system? Well, life expectancy is not a very good reflection of healthcare quality. Why do I say that? Because there are dozens of inputs into the ultimate life expectancy that have nothing to do with healthcare quality. We can look at that chart, and this is not a complete list, but things like lifestyle, population mixes that are different between countries, societal conditions that have nothing to do with healthcare, cultural differences, differences in the decision-making on standard of care. I'll go through a few of these. Here's one obvious one. If you're going to talk about the life expectancy as a reflection of health care quality, you might want to focus on the diseases that cause death that are somehow amenable to health care. By age group in the United States, immediate gunshot wound to the head, high-speed motor vehicle accident. There's not a lot you can do about that with a health care quality impact. And is this difference really that big between the US and elsewhere? Well, yes, it is. You can see that the combined deaths from homicide and motor vehicle accidents, just those two things alone, in the United States are 2, 3, 4 times that of other countries. Life expectancy alone is a very sort of dirty statistic to assess something like healthcare quality. It's also impacted tremendously by lifestyle issues, behavioral issues, optional lifestyle behaviors. This is an interesting chart from the OECD 2018 that shows the life expectancy of certain countries, and then we look at the percent of obesity in those countries. And you can see that it's almost a direct inverse. How important is obesity? Well, it decreases life expectancy from birth by 8 to 10 years, and if you just measure it from age 40, it takes 6 years or 7 years off of your life expectancy from age 40. In fact, when you do the calculation, obesity alone accounts for 40% or more of the life expectancy difference between the United States and almost every other country. Obesity is a lifestyle. What about infant mortality? This is the second statistic people say as a data-based criticism of the US healthcare, because we don't have a great infant mortality compared to sort of peer nations, if you will. Well, in fact, it was further highlighted many, many times in the news. This is an example of neonatal mortality, but US ranks 41st in the world behind Cuba, Slovakia, Croatia, all of Western Europe, Scandinavia. How could that be? Well, the first thing you have to do is look at the statistic. The United States calculates the number of live births, the denominator, very differently from all of our so-called peer countries. We record every live birth, 1 respiration, 1 cardiac beat as a live birth, no matter how premature the baby is, no matter what the size of the baby is, and not to mention that we have a very high incidence of lifestyle-induced prematurity. The other countries, many of them that are in our peer group, don't count a live birth unless the baby's survived for the first 24 hours or 48 hours, or is a certain size or a certain gestational age. So you've eliminated most of the babies that are going to die by excluding those babies. Just one example, comparing Sweden to the United States, if you look at the infant mortality rates, US versus Sweden, there's a massive difference. And then when you just compensate for standardizing for the gestational age distribution, okay, that's the number of months a woman's pregnant before the baby's born, it almost comes down just from that one change alone to similar, although not exactly equal, from one change alone. If you look at the infant mortality overall in these countries, the United States is at the bottom. If you look at the infants that actually need medical care, health care, the United States rises up to behind Sweden and Norway, Scandinavian countries, and ahead of everybody else. Now, this is literally not counting any difference between Sweden and Norway and the United States, which I think the differences are enormous in the patient population, let alone everything else. So the point here is those two statistics that are widely cited, life expectancy and infant mortality, are not good statistics at assessing healthcare quality. And there's no healthcare expert, really, that would say that they are good statistics, yet they are the ones cited because they are the only statistics out there that even remotely support this contention that the United States has poor health care. In fact, even the OECD, which is essentially a liberal organization of the think tank, said health analysts don't even like to talk about the WHO report in polite company. It's one of those things we wish would go away. Well, what are the facts? The facts are that the United States is the gold standard of excellence for medical care. Now, why would I say that? Well, we have the best survival from cancer, the best access to treatment, the best treatment outcomes for almost all serious diseases, the most frequent usage of screening tests for early detection, the fastest access to new drugs, the best access to safer, more accurate diagnostic technology, the quickest access to life-changing surgeries, the fastest access to specialists, and we are the #1 source of the world's leading innovations by every metric. And that's based on the data. And if you want to read the data, I'm not pointing to my book as the data, I'm pointing to my book as a compilation of more than 500 sources of data on this with charts, and it's out there for free. It's a dry read, by the way. Okay, I'll just show a few slides to illustrate some of these facts. A lot of this is pre-Obamacare data, and that's the whole point, because you need to know what started this whole radical change to the U.S. healthcare system. 5-year cancer survival rates, U.S. versus the paradigms of healthcare of Western Europe that we hear about all the time. Statistically significant differences, men and women, and in fact, in a less crude way, every important and almost every minor cancer, we have better survivals than all of those countries. What about access? And here I'm just highlighting things, not because I'm cherry picking, because I can't go through every disease. I don't have 8 hours here. But the access to treatment, let's take the most common and most important, arguably, chronic disease, high blood pressure, hypertension. The United States, of people diagnosed with hypertension, what percent actually receive treatment? 53%, which you'd say, wow, that's terrible. In fact, the New York Times said it's shocking evidence of how our complicated, dysfunctional healthcare system can't deliver care. And it sounds reasonable, except they didn't bother to look at the other countries in the same study. Because when you look at the other countries, England, Sweden, Germany, Spain, Italy, Canada, they have, plus or minus half of that. What about the outcome of treatment? We treat them. Does it work? Well, yes. Our treatment actually works better for something as straightforward, relatively speaking, as high blood pressure than any of those other countries. Significantly better. And the conclusion from that by the OECD was that quite clearly the U.S. has the most diagnosed high blood pressure, but the fewest people with measured high blood pressure because of the aggressive use of drugs. That's better medical care. What about screening tests for cancer? You would think a government-controlled system would be able to implement screening tests. No. The United States has better access to screening tests for mammograms, pap smears, PSA, colonoscopy, sigmoidoscopy, men and women, than Canada, as one example. By virtually every measure, the vast majority of innovation in healthcare comes out of the United States for the world. New drug invention. Intellectual property country of origin, 1998 to 2014, the USA. clinical trials simply in the top 5 hospitals in the United States compared to other countries. First launches of new cancer drugs. And by the way, cancer drugs are the most, by far the largest proportion of all new drugs. USA dominates. Shares of new drugs, new active substances, out of the whole world, the USA has roughly half of all new drugs and 2/3 of the novel drugs in the United States, not only invented but usable, approved in the US before any other country. What about safer, more accurate medical technology, so-called minimally invasive care, which is actually the goal of all medical care, to be able to use minimally invasive care. And here we're just comparing to the G7 countries, some who are overloaded with technology in general and spend quite a bit of money on healthcare, yet the USA leads statistically significant differences than any other country. Inventions of significance in healthcare. According to thought leaders all over the world, what are the most important medical inventions in the past 20 years? The USA invented almost all of them, or co-invented.